Dr. Kim, you have literally changed my life. I was referred to you by my urologist here in Atlanta, Dr. Gregory Mitchell of Piedmont. Shout out to him, who referred me to Dr. Erwin Goldstein, who referred me to you at Excel Spine. And my name is Tara Lane, based in Atlanta, Georgia. And I spent 13 years literally in and out of doctors' offices dealing with so much pain and multiple issues. Everything from the waist down hurt: my lower back, my sacrum and tailbone, my seat bones, urethra, terrible bladder pain and spasms and urge frequency. My leg, especially my left leg, was going numb, and I was struggling to use it to walk in daily life. I saw urologists, neurologists, orthopedics, primary care, etc. And I was very fortunate to find Dr. Chol Kim of Excel Spine. And I had surgery to remove a Tarlov cyst on S2, as well as imbrication. And it was a very, very successful surgery, and it changed my life.
Wow. There's not much else that can make somebody feel better when they do something for their work, and it leads to this. So thank you for that. Let me tell you my side of the story. I'm the privileged physician, the surgeon who took care of our gal here, all the way from Atlanta, Georgia. And she had a very small Tarlov cyst. And she had lots of pelvic symptoms. Now, the pelvis is way more complicated than the legs or the arms. There's a lot more going on in there that's both voluntary and involuntary. Whereas your leg, it's just like it does what you tell it to. Your pelvis, there's all these things that occur that's beyond your control, that's automatic. So when there's a neurologic dysfunction in the pelvis, all sorts of weird things can happen that's really difficult to sort out. And that's why you probably have seen multiple doctors and eventually had to see probably one of the most knowledgeable, most well-known, most renowned urologists on the planet that understands what goes on in the pelvis, especially with the genitals and all the organs inside there. And he's a urologic surgeon. And one of the things that he noticed is that a group of his patients had symptoms and they all had Tarlov cysts, which we always think are incidental findings.
No one told me I had a Tarlov cyst. However, if you go back and look at prior scans, the Tarlov cyst showed up for years, and not one doctor ever mentioned it or said anything about it.
Tarlov cysts are one of those things that we've all heard of in medical school, but we've all been taught in all of our training that it's not something that you tend to mess with, and that it's usually incidental. In other words, it's a finding that usually does not have symptoms. But here's the rub. Most of the time, usually, is not the same thing as saying always, because if you're in that small category of patients that has a symptomatic Tarlov cyst, it's a big deal, but we're so brainwashed into thinking that virtually no one has it, yet your symptoms have to be extreme for them to recognize it. So I was one of those surgeons too, until 10 years ago.
After having the surgery and just being so much better, I have 90% less pain than I had prior to surgery. I'm still obviously in the healing process. When I'm talking to some of my doctors, they're locally in Atlanta, they're coming to an understanding that, okay, wow, this really was something that was the root cause. And as you know, my Tarlov cyst on S2, it sat in a lovely little place where your pudendal, your sciatic, and your pelvic nerves all came together. So, I mean, my issue, my pain, it was everywhere from the waist down. Pins and needles feeling in that.
I think that's what's difficult, is that the nerve area that it irritates are the nerves that go to your pelvis as well as your legs. And any combination of symptoms can manifest itself depending on the individual. It's like Russian roulette. So I'm not surprised that you have all these weird symptoms, because that's what Tarlov cysts do. In the worst case scenario, you can't pee or you're become incontinent. But that's the end stage. And when you wait that long, treatment is terrible. The surgical success rate is low and the complication rate is high. That's why catching it early makes such a huge difference, because I was worried that my patients that I did Tarlov cyst surgery on would not do very well based on the information that's out there and what I've been taught. But if you catch them early, I found out they're some of my happiest patients. Very few complications, very little postoperative pain, and we're really, really careful about who we decide to operate on. And we've noticed that even small Tarlov cysts can cause big symptoms. So really the question boils down to, how do you tell the difference? Because they look exactly the same on imaging studies. And one of the things that we do is a multidisciplinary approach to the evaluation. So like you see a urologist, you may see a primary care doctor, you may see an OBGYN, you may see a pelvic floor physical therapist. And then you may even need to see somebody like Dr. Irwin Goldstein, who specializes just in the pelvis and has a bunch of tests that no one really knows how to do except him. One of them is called neurogenital testing. And he does all these things, and then he decides, could it be neurological? Could it be coming from the spine? And if so, we also get imaging studies of the pelvis and the lumbar spine. And after doing all those things, if we're thinking maybe it's the Tarlov cyst, we do a targeted injection. It's called a caudal epidural, where we bathe the Tarlov cyst in medicine and see if you get better. And if you get temporarily better, that's the nail in the coffin, the last nail in the coffin that tells us that it's probably that problem. And you're that patient. And when we do surgery on patients like you, we get some of the happiest patients on the planet. And that's her story. And fortunately, it happens a lot. No surgery is perfect, but it's the Tarlov cyst surgery, which originally was very nervous about because of all my education and training around it, which is really misleading. But now that I know better, it's some of my happiest patients. I love doing this surgery because patients do great, and that's the most important thing. Even though it's really tedious, and it's like taking gum out of shag carpet, but the carpet's like the most, it's like a family heirloom that is priceless, and like every fiber is like thinner than your own hair, so you have to use an operating microscope and tiny little instruments. But besides that, I love it. That's what that surgery is like.
And you made me taller. I don't know how that happened,
Probably because you're not in pain. People in pain don't stand tall.
Maybe that's what it is. I have my posture, and other people have noticed that I look better. I have better posture. I stand taller. I notice things when I'm driving down the road that I never noticed before. Leaves and trees and buildings and restaurants. I think pain just does something to you. And when you're in pain for so long, you're just trying to get through the day, and you just don't notice much outside of that. Hey, I played ping pong about 2 weeks ago. I hadn't picked up yeah.
It's a fun game.
I did fine.
Nice.
And in the past, if someone had said, "Oh, I'm inviting you to a birthday party on a Saturday," I would think to myself, well, I can't tell them yes now. I have to see how am I doing that day.
Wow.
And if I go, I'm not going to be able to do anything else the rest of the weekend. I've literally lived on my couch outside of, business travel and a little bit of travel here and there. But even that was very carefully curated and managed. When you've been in and out of doctors like I have, I just feel like even the front desk of going into a lot of medical facilities, the people just genuinely aren't caring or happy to see you. And literally the moment I walked into Excel Spine, I felt like I had new friends. Everybody was great. There's a reason I got on a plane and came out to San Diego for this surgery, because I did my research. I did not take this lightly. And I knew that you had performed thousands of surgeries. So just your credentials in general and your success rate, I knew I was going to you. I won't name some of the other surgeons. There aren't many that I researched, but I knew I was coming to you. You give your personal cell phone out to patients, and that's almost unheard of. I know you probably talked about that before on some other socials, but that's huge.
It's amazing. No one ever calls me. I've literally given out my cell phone number since I've had it for 20-something years. If you wanted to reach me while I was on staff at UCSD, first you had to call the hospital. Then the hospital called the intern. Then the intern had to talk to you, then discuss it with the junior resident. Then the junior resident needs to discuss it with the spine fellow. Then the spine fellow would then like look at everything and then come talk to me. And by the time I find out about whatever's going on, the patient was out of their mind crazy. So I finally just said, next time just call me directly, okay? And then I will get all those other people involved. You don't have to go up that chain. It's such a headache. And that's how it all started.
I did send a couple of texts and you answered immediately, and I was pleasantly surprised.
What's something that you wish somebody would have told you before surgery that you now know?
I don't feel like there's anything that I wish I had known, but I will tell you that flight back was pretty brutal. Looking back, if I could have maybe waited another week. What
about if you would have left just like the next day or the day after instead of waiting a week? Because the week is you're in the middle of the inflammatory process of healing. What if you just flew back like the next day or the day after instead of a week later?
That I don't know. I don't know if I would have felt better flying back the next day. But I think if I didn't fly back the next day, I think if I had stayed at least two full weeks, because I felt like not only was I in pain on the flight back, because it was a 4.5 hour flight from San Diego to Atlanta. I didn't have like the continuous strength to sort of hold myself up. It just,
even 2 weeks, you would have felt really good to do that. That's good to know.
I would have felt a lot better. Yeah. But everybody's different. I mean, maybe someone else wouldn't have that experience.
I'm going to keep asking. I would like to know that answer. Like, what would be the optimal time to fly back? I'm just guessing. I figured it was either the next day where you're a little groggy and don't know any better and can't remember anything, and the inflammatory process of healing hasn't kicked in, and just get home as soon as possible so you can sleep in your own bed, in your own familiar environment. Okay, I have a question.
Okay.
What were you most scared about? Anesthesia, the surgery itself, like something bad happening with the surgery, the postoperative pain, the amount of improvement you're going to get. What was the scariest thing?
I wasn't worried about the surgery itself because it was you performing it, and I knew who you were, where you've gone to medical school.
And you saw my delicate Asian fingers in action.
Yes, which I said that in your lobby, and the women looked at me like I was crazy. And I said, I didn't make that up. I said, Dr. Kim made that up. I saw it on social media.
I can always tell people that have watched my surgery videos because there's a few things that I say all the time. That's one of them. It's true, though. Look at how delicate these hands are.
Yes, the delicate Asian finger twirl. I'm just, I'm glad you made that up. I didn't say it. I wasn't nervous about the surgery. I was very nervous about the trip home on an airplane after this type of surgery.
That makes sense.
And I was not as nervous as I've been in the past about the anesthesia because we had so many conversations that I don't react well to it. And so they made sure that I was hydrated, that I had my promethazine so that I wouldn't be nauseous. So that I wasn't as nervous as I've been in the past. I think the trip home and the recovery, because everybody's different. And we talked about that before the surgery. And, what does that look like? And so for me, I listened to you when you say use pain as your guide. And I made sure I didn't overdo it, but made sure I was walking to the end of my street and eating very healthy and hydrating and getting sunshine, all of those things. So I was really surprised at how well the recovery went.
That's the hardest thing that I struggle with too in coaching people. I'm not too worried about the surgery, definitely not worried about the anesthesia. I'm not that worried about the postoperative pain, but the recovery process is so variable from patient to patient.
I have a lot of people ask me, did he remove the Tarlov cyst or did he drain it and then do the imbrication and tie it off? Because I get a lot of questions.
You want to get deep into it. You want to know exactly what I did. Okay, you ready?
Ready.
It's actually not a cyst. A cyst would be like a water balloon filled up, right? It looks like a cyst, but in reality, it's more like a honeycomb or one of the little combs, one of those little hexagon things, gets really big compared to the other ones for one reason or another. And the reason probably is that those little walls are actually these thin little tissues that organize the nerve rootlets. Like there's hundreds of little nerve rootlets that are inside a nerve, and they have to be organized relative to each other, and they have to be floating around in spinal fluid, but kind of stay organized. And so it's like these really thin curtains that organize these little nerve rootlets. Now imagine a situation where those thin little curtains get really irritated for one reason or another, and they get inflamed and thickened. And all of a sudden they become a one-way check valve where, because there's a bunch of them, the liquid, the spinal fluid that gets pumped in there gets stuck somewhere and starts pulsating and making something bigger because it doesn't have a really good exit. It's like a one-way check valve or a traffic jam in there. You know what I mean? And so that's basically how it happens. And your body probably goes through periods of inflammation and non-inflammation, inflammation and non-inflammation. And the few people that probably become symptomatic are the ones that develop a chronic inflammatory problem in there, where the inflammation will not turn off. And I'll give you an example of how that occurs all the time in other areas of the body. If you've ever had tennis elbow, golfer's elbow, or plantar fasciitis, you'll know those conditions are really, really painful. They last for like months, if not years. And they don't look like much on imaging studies, but they're really bad in terms of symptoms. Anyway, so these thickened little filmy curtains, that's called trabeculae, are the causes of that one-way check valve. So what you do is you open up the outer membrane called the dura mater. It's like the drape. And as soon as you do that, either spinal fluid comes leaking out or one of those little combs, looks like a little soap bubble, will come floating out. And so you'll pop that, and then you'll take this tiny little instrument called a nerve hook. It's got a little hook on it. It's really tiny and kind of pointy. And you use that and you just sweep back and forth and you're just breaking up those little adhesions, sort of like you're breaking up scar tissue. So that now all the cerebral spinal fluid has a way to flow. And then you take the outer dura mater, the drape part, and you sew it back together again. And in the process, you grab a bunch of tissue together and bunch it all up. That's the imbrication part. And by the time you do that, it gets to look like normal. Because the body's weird. It will kind of go back to what it was supposed to look like. It has a memory almost. And so by the time you're done, you've broken up all the little walls, you've drained out excessive spinal fluid, you made sure everything's free and clear and flowing, and then you've closed it so that it's a more normal shape. Now, the last thing that I do is I reinforce it by taking this really highly purified collagen called Duragen. It looks like a little white sponge, really thin. It's made out of collagen, like really pure. And you cut little pieces and you lay it over the nerve. And then you dribble this gel called Tisseal. It's basically what makes blood clot, but it's clear. It's like a jelly. And then you wait for it to kind of solidify. And then I take a little bigger piece of Duragen and lay it carefully over that. And I put another little layer of gel. And then I do that one more time to get a 3-ply reinforcement. I don't put a plate on there. I don't reinforce it with fat. That's my closure. And then I just close the wound, watertight, and I have the patient get up and move around right away.
And you sent a video for myself and my family.
And I make a video usually.
The OR, which was amazing, unbelievable.
You know how those videos are made? On my iPhone. I tell somebody grab my iPhone, turn on, because everyone knows how to use the video on an iPhone.
Oh, I do have to give a shout out to Sharps Memorial Hospital. I think they asked me 10 times what surgery I was having, which is great because I love it.
I love OCD, and yes, I check my car alarm 3 times before I come in. Good. Do you know how many times I notice how different people are before and after surgery? Because when I meet people before surgery, they're just miserable. And they're not at their best, and they're usually not well groomed. They're usually not charming. They're kind of cranky. They're cranky with their loved ones. They're cranky with me. They're cranky with my staff. Then I do the surgery. They become themselves again. Then they come to the office, and I'm like, it's nice to meet the normal you. Like life is normal you. I have to remind everybody in the office that people get cranky when they're in chronic pain. Especially when you have to fly out from far away to get their care. That must have been really frustrating.
I've had so many people tell me, you look better and your coloring looks better and your eyes look brighter and you just seem to have more energy. It's, I
Yep.
mean, it's night and
I
day.
can tell as soon as I walk into a room how someone's doing, just by their posture and their facial expression and their within like 5 seconds, within just like their first movements.
Dr. Kim, thank you. Thank you for changing
Thanks
my
for
life.
organizing this, Halleck.